get started. Picture it. You and your loved one are sitting in a hospital room. There's a knock at the door and a white lab coat enters the room. One simple statement, 3 words, and your world is about to come to a screeching halt. You have cancer. This was my reality in March of 2018, almost 2 years to the date. Pancreatic cancer. Ask anyone that has heard about pancreatic cancer and they automatically begin grieving for you. How do you get a cancer patient out of pain? How do you get them to eat? How do you get them to be able to enjoy life? Medical marijuana. Medical marijuana is the one reason why my husband is able to overcome the symptoms of cancer and chemotherapy. According to the National Cancer Institute, in 2019, there were 1.8 million people diagnosed with cancer. Out of those 1.9, 600,000 will lose their life to cancer. Let me read those numbers again. 1.9 million diagnosed, 686,000 possible deaths. That number is somebody's mother, father, husband, wife, or child. Now that medical marijuana is legal in Arkansas, we have witnessed less drugs. Let me rephrase that. We have witnessed less arrest for drug possession, and more patients are seeking the help of medical marijuana as opposed to opioids, meth, cocaine, and prescription painkillers. That's important. When my husband was diagnosed with cancer, we didn't know what the answers were. We didn't know anything. It would be 2 weeks before we could even see his oncologist, and it would be another 2 weeks before he would start treatment. The only thing that goes through your mind is there is cancer inside of your loved one, and it's growing because it's not stopping. We haven't started anything. We haven't started any chemo, we haven't started any radiation, we haven't started to treat it, and it's still growing. During that time, my husband was okay. Emotionally, he was a mess. Emotionally, I was a mess. But we were able to overcome that, and he started chemo. He started chemo in April, and he was doing okay. There were some symptoms that he had, just like any other chemo patient would have. He was lethargic, didn't really want to eat. His anxiety was high, which was making my anxiety high. It was a lot. We went through a lot. Just as things were starting to calm down, get back to normal, we experienced our second scare. My husband was getting his 4th round of chemo when he had a brain aneurysm, which sent him to the hospital. He stayed in a medically induced coma for about a month. He went to the hospital rehab for another 2 months. He came home. He's now walking without a cane, without a walker. It's a miracle. But we still have to fight the cancer. My husband was given 30 rounds of chemo radiation, and on December 23rd of 2018, we got the news that he was in remission from pancreatic cancer. Not a lot of people get that news. We were lucky. We still are lucky. Medical marijuana was able to help my husband regain his weight from the medically induced coma that he was put into. He lost a lot of weight to the point that his vertebrae was showing. we tried everything over the counter. Doctor prescribed Majestinol, which is something to help a chemo patient have an appetite. Another drug. We tried opioids, but my husband was in so much pain at one point, he was eating them like candy. Then you have the stipulation of, well, we have to wait. We can't keep refilling these so fast. Cool. The solution was medical marijuana. We had our oncologist sign the paperwork, and within about 3 or 4 weeks, we were able to go to the dispensary, and he was able to get medical marijuana. Within the first night, he was relaxed. He was eating. He wasn't in nearly the amount of pain that he was in, and I was slowly getting my husband back. I have my husband back now. He has gained the majority of his weight back. He is still on medical marijuana. He is still gaining weight. He has he has a love affair with frozen pizza. You know, if you want to look at the statistics again, everything chemical is produced from labs. Medical marijuana is produced from plants. It's natural, it's healing, it helps. Now, I am not a medical professional whatsoever. I don't have a medical degree by my name. I'm a CNA. I'm a hospice CNA. I've seen a lot. I was witnessing a lot with my husband. In fact, one of the reasons why I chose this subject is because I need more people to understand the importance of this drug, because it can overcome so much, and it can ease a person so that they can relax and enjoy the things around them. The codependency, there hardly is any. If there is some, they are to the point of they're going to eat a pizza and go to bed. Nowhere near as addictive as cocaine, meth, or painkillers. You know, we have come so far in this fight to get medical marijuana approved. We need to go a little bit further and get recreational approved as well. So many people are scared because it can lead to other addictions. But for the people that need it, it needs to be, it needs to be available for them. Insurance companies need to pay for it because it is helping. I wanted to take another few minutes and thank you for allowing me to express this opinion of mine, along with some research that I have done. And I hope my little spiel has eased your mind about medical marijuana, that it's not such a scary thing. It does help. It really does. My husband's proof. Thank you for your time.